can we start? Thank you very much.
The operating theatre, a place of hope and fear.
You've been so brave. Rest your head back, sweetheart.
Some of these patients come in, they're really scared.
You're not okay, because I can see it in your face.
We're back in day surgery at the Queen Elizabeth Hospital,
Where's the Queen?
where the theatres, beds and staff have been rigged with cameras.
We work wonders here.
We use humour in theatre.
So you win some more local anaesthetic.
Capturing familiar faces hard at work.
No karate in here today.
Bless her, look how little she is.
Love you.
Performing complex operations.
You never know what you're going to get. It's exciting and I absolutely love it.
Is he all right? Is he breathing?
And changing lives.
Stand clear, please.
Inside the operating theatre.
I've never had anyone who said they haven't enjoyed it.
Right. We can tidy up.
I'll tidy all that up. Yeah. The surgeons can't cope without the nurses. They would be nothing without us, quite frankly.
What else have you got in today then? Doing all sorts.
Surgeons are very focused on their one job, aren't they?
So we have to look at everything, multitask.
The whole picture.
That's it.
Like that pin that holds the whole little thing together.
Yeah, I think so.
You're having the left foot excision biopsy of suspected into something.
Handwriting.
Oh, yeah.
I think the more high up you go in medicine, the worse your handwriting has to be.
True, yeah. Scribble.
Yeah. Yeah, the ability to be able to make a continuous squiggle and expect someone else to understand it.
I think they rely on us to keep them on the straight and narrow.
They rely on us a lot more than what they will ever give us credit for.
Yeah, definitely.
Yeah, definitely.
Hello.
Thomas Green.
Thomas, that's lovely. Just have a seat, Thomas, please. Thank you. Thanks.
I'm Thomas, I'm 15 years old and I'm in year 10.
I left your book in the back of the car.
It's really
right, you've got one, haven't you? Yeah.
With me today is my mum and my mum's mum, Granny.
Hello. By the method of elimination, you must be Thomas. Hello. Hi, I'm Chris. Come this way.
Okay.
Shall I stay
Nice
here?
to meet you.
Oh, you want me to come?
I'm incredibly nervous.
Lovely. Just down to base forward to the far end.
They told me I wouldn't feel anything, so hopefully they're right.
And then the last bed on the right, Thomas.
I came here because the dentist said I need braces, but to do that, they need to take out my baby teeth.
Right, first things first, so I'm Chris, I'm one of the staff nurses. So I'm going to be helping Mum and Gran look after you today. And do you know why you're here today, Thomas?
Yep.
Yeah, so is it teeth extraction?
Yeah. I have this canine right there, which I can actually fit my tongue behind because it's so far forwards. Like that. And when I get my braces, they're probably going to put them over my teeth and just hold them into place, and hopefully they'll stay.
So actually, teeth extraction is easy, I promise you. Okay. Because up here, we overthink things, and the thought of having teeth pulled is horrible, but actually it's not that bad. Yeah, exactly, that's it. So we overthink things, don't we? But actually, once we get the medicine in, they literally just slip out. It takes minutes. Sleeping and waking takes a little bit of time because you're a young teenager, so you'll be lazy and you'll just snore your head off, and I'll be poking you going, come on, wake up, wake up.
It's been like ours this morning.
Thomas is fairly typical for his age. He is witty, he is funny. He puts himself down a lot though. He doesn't have a lot of confidence.
Lovely, pop this on your finger, anyone?
We say that he should have more confidence in himself because he's got a character. He is good fun to be with. His friends like him.
He's got nice chilled out pals.
Has he?
Getting about 66.
Excellent.
Are you very sporty?
I did karate at school, but that's about it.
Right, no karate in here today.
No.
Can we just remember that when you're waking up? Yeah, no.
Hiya! Pow! Knock someone out.
No karate in the recovery room.
Thomas needs 4 teeth pulled out. Because of his fear of the dentist, it needs to be done under general anaesthetic.
The thought of having teeth pulled is horrific for anybody, whether you're young or old. Most children will come in not wanting to have teeth out.
What happens to the teeth? Does he get to keep them?
So I'll just have to check with our community dental team with baby teeth. They do get them to take home for the tooth fairy.
All right.
But with these adult teeth, they're not always the case.
Well, they are actually his baby teeth as well.
They? Okay.
There we go.
Well, we'll mention. Yeah.
Our
Maybe you should
tooth
get
fairy
some.
went on strike years ago.
Mr. Narayan will perform the surgery, and Thomas is one of 5 patients on his list.
Hi there.
Hi.
Have you got Thomas Green?
Yep.
Good morning, Thomas. My name is Shankar Narayan. I'm the consultant oral surgeon. Right, Thomas, do you know how many teeth are coming out in total?
Isn't it like...
It's going to be 4 now because one has dropped out.
One has dropped out.
Yeah.
One less to worry about then, isn't it?
Exactly, yes.
Okay. So the question I got for you is their baby teeth. Normally this sort of a thing is done with injections at the dentist. What made you come our way? Was there a problem in having anything done before?
I chickened out.
Right. Okay. So you went to the dentist, you had the process.
Tried a couple of times.
They did.
And it was very, very nervous.
Okay. That's fine. You tried that process and it doesn't work for you.
Yeah.
That's okay then. It's okay.
It is quite rare to give a general anesthetic for somebody to have baby teeth removed. To have a tooth removed is quite stressful for some people. To have 4 of them removed really put them off.
Lovely. Yeah. And we'll see you before you go as well.
Yeah.
Yeah? Okay. Well done. Take care. No worries. Catch you soon.
Jolly good.
Have you been in here before?
Yeah.
Okay. So we're going into bay 2.
I've come with my husband to give him a lot of support because he's very, very nervous. He's worried he ain't going to come out no more. He's really, really worried.
Okay, my darling, have a seat.
We've been married 60 years. She was my only girlfriend. I love her to this day. It's the same day as I did when I got married. We went to school together. One in the boys' side and one in the girls' side.
I met him when I was 15 at school and we've been together ever since.
But their lives were turned upside down 6 years ago.
One day I went to the toilet and I looked down and blood was coming from my penis. I was frightened, so I called my wife and she said, "Well, get you up the hospital straight away."
When did you last have something to eat?
6 o'clock this morning.
The hospital diagnosed Les with bladder cancer.
I did have chemotherapy as a result of what I went through. The chemotherapy did work. I'm really grateful, but I don't know what will happen after today. Whether I'll have to go through a chemotherapy again. How long does this normally take?
I would say you'll be in theatre for about half an hour,
Yeah.
okay? But you've got on a long list of people today,
Yeah.
okay?
Bladder cancer has a high level of recurrence, so Les needs frequent checkups. At his last appointment, there was a problem.
I tried to put catheter in there, Timmy, and that wouldn't quite go in. There's a little tiny blockage in the pipe. I have to have this operation because they wanted to check there's nothing wrong.
Have you got any questions at all?
No, not really, no. Just want to get down and get done.
Of course, of course.
Les's surgeon is consultant urologist Mr. Amanu.
First patient, he needs urethrotomy and cystoscopy. He has history of high-grade bladder cancer. So just keep biopsy set, TURBT set on the side. Let's hope that everything will be clear.
There's nothing I don't love about him. He is worried in case there is something wrong, but hopefully there's not, and then that will ease his mind. You don't know what's going to happen in the future, do you? You said roll it down. That shouldn't have been rolled down. That's getting all caught up now. Now you've got to pull it up.
Consultant urologist Mr. Amanu will perform the operation.
Hello.
Hello, right.
Good afternoon. What we are going to do today is that you'll be under anesthesia, and then we go with a telescope. We'll have a look at the narrowing, and then we will use a knife that looks like a pinhead, and then we use it to open up.
Okay.
So that we'll be able to have a look inside your bladder with the camera, as well as the water pipe.
Well, that's what I can't understand, because I don't have no trouble going to the toilet.
Okay.
Yeah.
But you know, the reason why we do it is not because of problem with passing urine, because we need to see your bladder.
Oh yeah,
as part of your normal surveillance.
Yeah. Well, it's a good job they do.
Yeah.
Bladder cancer has a high level of recurrence. Les needs to be monitored for at least 5 years, or perhaps the rest of his life.
There's a possibility that we may have to do something more, just like biopsy or scraping, anything that we see that looks abnormal to us. Is that okay?
Yeah.
Okay.
Well, you fellas know what you're doing.
Yeah.
You're the bosses.
If we have to do something extra, we may need to admit you.
Okay.
Yeah. Okay. Do you have anything you want to ask? Anything to clarify? Okay. Okay. See you then.
Yeah. Lovely. Thanks very much.
Thank you.
We wouldn't be without each other. If anything happened to me, he wouldn't cope, and if anything happened to him, I wouldn't cope. Yeah.
Here we are again, so we're all ready for you now, Mr. Bunn. So we just need to
Hello.
go through it.
Hello, I'm Zoe and I'm going to take you, okay?
Yes, we need to look at your
Me
armband.
last time, didn't you?
I recognise your face.
Well, I told you about me being married, didn't I?
Yes!
That's her.
All those years.
Yeah.
Yeah.
60 year. Next
Made
month.
my heart melt.
I want a medal.
Yeah. I told my boyfriend all about you.
Yeah.
It made my heart melt.
Yeah. Well, that's.
It's really special. But we better get down.
Yeah.
You're down to theatre, my darling.
I'm just worried about him, you know, whether he's gonna come out of it all right. I'm here.
She can make herself comfy in this chair now.
Ready to
Off you
go?
go.
Yeah, you follow me then.
Yeah, all right.
Mr. Amanu is assisted by Mr. Abu Yusuf.
Bladder cancer is one of the cancers that tends to come back. That's why frequent surveillance is quite important. Stricture is a narrowing in the water pipe, which is basically a scar. You need to have an open water pipe without a stricture, because if you encounter that stricture, then you won't be able to access the bladder.
Okay, we are starting. Okay, so the stricture is here. Going into the mucosa. Okay, here's a dense urethral stricture.
Guided by the camera, Mr. Amanu cuts the scar tissue inside the urethra.
I managed to cut the stricture and I'm in the bladder now.
Mr. Amanu needs to look for signs of anything sinister. Bladder cancer returns in 70% of patients.
Okay. I need to look it properly with a cystoscope, yeah?
So once you get into the bladder, Usually you have a detailed look in the bladder wall for any evidence of abnormal areas. Usually bladder cancers look like cauliflower or seaweed.
Yeah, and that's looking into the bladder.
And sometimes you can find areas of bleeding on their walls.
Okay. So if finished, we'll just try and catheterize you. Okay, I hope it goes in easily.
Les will need to keep the catheter in for 2 weeks to make sure the urethra heals around it.
Okay, finish. Thank you very much.
Thank you.
Does it feel tingly and funny?
That does, but not really.
What about the other hand?
Feels like a hand.
Thomas Green is about to have a multiple tooth extraction.
My hands are freezing.
He's been given some numbing cream on his hand so he doesn't feel the cannula going in for his general anaesthetic.
You feel that? Close your eyes.
Yeah, I felt that.
Did you?
Yeah.
It's the pressure, I think, more than anything.
Probably.
Yeah.
They're going to pull out my 4 baby teeth, and then 6 months after this, I'm going to go back to the orthodontist where she's going to put my braces in.
I tell you what, I've got a pin in my pocket. Just stick that in your hand, see if you can feel that. Come on. Well, you can do it, unless you want me to do it.
Don't jab, just touch the end.
I can't feel that.
You can't?
No.
No.
It's weird.
That's good. That's a good,
that means
good
it's worked.
test, yeah.
His teeth are out of line at the moment. Thomas is not very keen on needles. He is worried and is a bit scared. He's just very, very nervous before any procedures happen.
Right, come on, Thomas, let's get this done.
Oh.
We're going to walk you down, my man, because you're too grown up to push.
Cool.
Right.
I'm a terrible driver. And we've already got a bed there, actually, so we're going to just move the beds along.
Oh, right, okay.
So, see you shortly.
He hasn't got his shoes on, is that all right?
No, don't slip, that's what I say.
Yeah.
We don't want no broken bones en route.
No. Well, we're in the right place.
Yeah.
Almost. Hello there.
Hop up on there for me, my man. Mum, come stand next to him.
Because of Thomas's phobia, his own dentist has not been able to treat him. The only option left is a general anaesthetic.
I'm feeling very, very nervous about the operation. It's just the thought of being put to sleep, surrounded by strangers, really. Don't know what's going to happen.
Joe will help keep Thomas calm throughout the process.
I'm going to give your arm a squeeze this side, okay? And we pop a little cannula into your hand, which all the medicine goes into. And then the doctors are going to get you off to sleep, and they'll tell you when that's going to happen. Okay?
You'll be just fine.
Lovely. Right, let's have
So you give your hand to Joe. Mum can stand in here. Have you done your health one? Breathe in, just breathe in and out. Ow, ow, ow. But the next one won't hurt.
Ready for this?
Yeah.
Come on.
Leslie Dumpleton.
That's lovely. Just have a seat, please.
Okay.
Right, thank you. Where are you going to sit?
I can't say I'm looking forward to it, no. I've only had one operation before, and that was about 30 years ago. Hungry.
Yeah, I can imagine.
Cup of tea.
Yeah.
I'm just a little bit anxious about the general anaesthetic, really. I've had one before, and the only reaction I had was when I was coming round from it, I was like physically shaking.
Let's hope you get in early, hey?
So excellent.
Yeah.
No. Hopefully I'm first.
Yeah.
Now I've said that, it's going to be last.
Yeah.
Leslie Dumpleton, is that you?
Yep.
Hello, my love. My name's Betty. I'm looking after you today. Do you want to come through?
Yep.
Yeah,
You
sure.
can come through with her.
Yeah, okay, thank
Yeah.
you. Right, thank you. I'm here to support her and I will do that as much as I can. We've actually only been together for about a year, but we've known each other for 30 years. I'm her partner now, but I was actually the best man when she got married 30 years ago.
Have a seat, my love.
Thank you.
We met again recently and we're so compatible and we just love life together and we're getting on like a house on fire.
You're Leslie Dumpleton?
Yeah.
And you're having a...
Leslie's here to deal with a problem that's been bothering her for the last 2 years.
My nose just keeps bleeding for no reason. You're asleep and it can happen, which isn't pleasant, or you're getting ready for a night out and suddenly it decides to go. Just... Oh,
We're both aware that this could happen at any time. It's a constant worry and I think an embarrassment.
Leslie's surgeon is Mr. McPartlin.
Yeah, well, Leslie.
Hiya.
David McPartlin, pleased
Hi.
to meet you. I'm the consultant whose list you've fallen on today. The plan, I think, is to see if we can do something more definitive to stop your nosebleeds and have a good look around your nasal cavities and make sure everything looks all right.
I've had my nose cauterised 3 times already in clinic, but it hasn't worked, hasn't been successful, so now I've got to have this procedure done.
Still bleeding, is it? So what I'm going to do is have a good look around your nose to make sure there isn't anything there that shouldn't be there.
Okay.
And if I see anything that looks out of place, I'll take a biopsy of it.
Okay.
And then the plan is, rather than using chemical cautery as you've had in the clinic, to use a bit of electrocautery, diathermy, to just sort of seal the blood vessels that have been bleeding and try and stop them bleeding anymore.
Yeah.
The area of Leslie's nose that was bleeding has a very rich blood supply. Lots of blood supplies from different arteries all form a plexus at that area, so it's a very common area to bleed. In addition, when we sneeze or blow our nose, we raise the pressure in the vessels, and this can cause the blood vessels to start bleeding again when they were on the way to healing themselves.
Good. Okay. Happy? You're on the end of the list, but it's not a particularly long list.
All right.
Towards the end of the morning, we get sorted.
Okay.
All right.
Yeah.
Okay. A little bit of a hanging around.
much.
All right. See you shortly.
Thanks. The end of the list.
Hello, Leslie. Hello, my love. Okay, operation's all finished. All right, you've done very well. You're just waking up now, my love. Can you hear me?
Les Bunn is in
Leslie.
recovery.
I'm just going to sit you up slightly, okay?
He's had surgery to fix a blockage in his urethra and screen his bladder for cancer.
It's all finished. Operation's all done. Okay? Hello.
Rub your eyes.
I think those eyelids are a bit heavy, are they?
Hello. Oh.
All right? You okay? Not sure. Can you give me a thumbs up if you're okay? No. Oh, we got a thumbs up.
Got a thumbs up.
Good man. Have you got your wife or anybody with you? Yeah, on the ward? Good, okay. Have you been married a long time?
60 years.
60? Wow. What's your secret then to stay happily married?
Give and take.
Give and take?
Who gives, who takes?
I think the husband should give and then the wife takes.
Should always take.
Is that right?
No.
Damn it, Joe.
Okay, my love. We'll get you back to the ward now. Cup of tea's waiting, yeah? Yeah, thumbs up to that one.
I am. I'm extremely shy. How dare you? Oh, so this is the lovely lady.
Oh, we've been hearing about you and your 60 years.
Am I in the way?
No, not at all.
Not at
Oh, he's been well behaved, haven't you?
He has.
Here
He's
she
been
is.
a gem.
Bless him.
He's been a gem.
Yeah, he's been good.
He's been worried he wouldn't come back.
He's getting a bit emotional there. You're all right. You're okay. You're fine.
We
You're
always
fine,
get our
Leslie.
man back.
Yeah, you
You're
can have a nice
welcome,
cup
my
of tea
lovely.
now. All right. Okay. Bye bye.
Excellent, sweet.
Good man. All right then. Bye bye. Take care.
Bye-bye, Miss Bud.
Bye. Oh. How are you? He's fine. Right.
Love you, Bernie.
Morning workout.
Dance? Done. We can be on Strictly next, can't we? Why not? We had some nice evening with the Celtic evening. All this sort of dancing.
Did you join in?
No, well, no, but it was all that and lots of Celtic singing.
All that?
All that. They're popping on the amazing.
Just relax though, relax.
Yeah,
you shouldn't feel this one as much
Yeah.
at all. You really shouldn't. Just pump it, pump it.
Thomas Green is going into theatre to have 4 of his teeth removed under general anaesthetic.
They're going to put me to sleep. It'd be like a straw thing on the back of my hand, and then they're just going to pull out the teeth. Hopefully the right teeth. It's just the nerve of actually having the teeth pulled out, I guess.
How old are you, Thomas?
15, and I'm about to cry.
Oh, yeah.
Finished.
Is it? Yeah.
Thomas has a severe phobia of pain. His dentist has previously had 2 failed attempts at removing these teeth.
This is the white stuff that helps get you sleepy.
Doing ever so well, just keep taking those nice deep breaths and just drift off to sleep then.
Yeah.
With the cannula now in, Thomas is a step closer to the teeth coming out.
How are you feeling in there?
Oh, yeah, there we are.
I think it's because it was sitting up, I couldn't put it on the wonky bit.
Lovely. All right, okay. Yeah, all right. Yeah.
Yes. Thank you.
He was good. Well
Yes.
done.
Yeah.
As a parent, it is difficult to watch your child going under an anaesthetic and that feeling of being out of control.
Thank you.
Thank you. See you later.
He will definitely remain my baby, definitely.
So we've got Thomas Green. So we proceed.
If his teeth are not removed, they could present problems for Thomas later in life.
Can I take a local? Is that okay?
You can, yes.
Overcrowding can cause tooth decay, gum disease, and jaw problems.
So we're removing the C there. That's going. Yeah. And the E. Yeah, on the top jaw.
Yes.
C and E. Okay. Some local going in.
Thank you.
Mr. Narayan needs to administer local anaesthetic to Thomas's gums before extracting the teeth.
Okay, and the lower jaw, that's an E there, so that needs removing. So we've got 3, 4, that's an E and a 6, yeah? So we're going to remove the E. Support the mandible, thanks. Okay. Put our swab, please. Okay, so we got 1, 2, 3, C. Yeah, we're going to take the C out. So there's a tendency for these forceps to slip on deciduous teeth, isn't it? Picklings. Right, low. Let's get the E out. So that is the 3, 4, and that's the E.
Okay.
Yeah, so just the E, I suppose. So that's the 6, that's the E, yeah. Lovely. That's fine. Ladies, we are done. We're just cleaning it up now. That's fine.
All 4 of Thomas's teeth have been successfully extracted.
Right, so there's one baby tooth that we didn't remove, which is already dropped out. Any concerns for recovery?
No.
No. Goody goody?
Thank you.
20 minutes after going under, Thomas is in recovery.
Tom, it's all finished. You're just waking up. I'm just going to have a little look at your eye.
Hey Tom, it's time to wake up.
Tom, Mum and Gran are waiting for you. You need to wake up now. It's all finished.
Tom, you're just in the recovery room, buddy. It's time to wake up. Come on, sleepyhead. Thomas, wakey wakey. There he comes. Hello, my man. All finished?
Tom.
Can you open your mouth for me, Tom? Really wide. Just
Wide
open.
up, there
Well
we go.
done.
Let's take that one out as well.
Hello, buddy. Just waking up. Well done. Just gonna sit you up a little bit. Just rest your head back, my man.
Can you open your eyes for me, Tom? Hello. Everything's finished. We've got your teeth for you. We managed to hold on to them. Just lay nice and still, Tom. We'll go and find Mum.
You're just waking up, buddy. We're just going back to the ward.
You made Chris jump.
You weren't long. Nice and quick.
His teeth, you right?
Yeah.
Who the hell are you?
All right. Hello.
That's good lad, isn't he? He's got his teeth for the teeth fairy.
All right.
Pharmacy.
What time is it?
Oh, no, don't worry. Lie down.
time is it?
Lie down, Tom. That's okay.
Question of interest.
Okay.
Where am I?
So you're back in the ward. Back in the ward where you were earlier. All done.
Really?
Operation's all finished. Put your glasses on, my man.
Might not be so fuzzy then.
See the world a bit better.
Is that everything in focus?
A lot better.
A lot better, good.
Leslie Dumpleton is about to have an operation to try and stop her persistent nosebleeds.
Probably had it about 2 years. It's like weak blood vessels, so then they have to go in and sort of solder them. It's like a long instrument. Yeah, I try not to think about that bit.
Probably what I'll use is most likely the bipolar forceps.
Mr. McPartland is her surgeon.
Now let's just have a little look up the nose first. This is where she's bleeding from. Is the suction connected? Yeah, thank you. And so as soon as we touch that, it's bleeding. Bipolar forceps, if you can set them up, that'd be great, thank you.
Yeah.
Once Mr. McPartland locates the problem area in the nostril, he uses electrocurrent to seal the blood vessel.
A little swab or something, I can just...
Yeah, it's just...
Okay, let's have some Naseptin cream then, please.
Yeah, Naseptin then, please.
Thank you. Yep, that's enough. Have you got the wet one there? Just tidy up around the nostril. Thank you very much.
Thank
everyone.
you.
That's lovely. Insulated speculum.
Yeah, I'll tidy all that
You
up.
got that?
Yeah,
Okay, thank you.
The operation has taken just half an hour.
Recovery! Hello again.
Hello. Stick your tongue out.
Hello, honey.
Yeah.
It's all done.
Good, good.
Okay?
Yeah.
So we'll take a couple of more obs and then we'll get you back to the ward for a nice cuppa.
Oh, sounds good.
Yeah? Well, don't get too excited. It is NHS tea and coffee.
Yeah.
Yeah?
Dodgy.
All right, then.
So look, Gammon, I can't speak. Glamorous.
Do you look glamorous? Oh, yeah. Look stunning. Yeah. Stunning.
Is your partner on the ward?
Yeah, unless he's done a runner.
I'm only winding you up.
When I met Dean, because I've known him 30 years, I've got to tell you this, because he was the best man at my wedding.
Was he?
1988.
Oh, hello.
And I didn't meet him until last October.
Mm-hmm.
And it was like talking and that.
Who was your best man? But did you fancy him then?
Oh my God, yeah. I thought I'm way out of he's way out of my league. And then we bumped into each other last October and rest is history.
Is he the one?
My God, yeah.
Right, my lovely, should we get you back for a cuppa?
Yeah, it'd be good.
All right. Just tell us all about you, Dean.
Yeah.
I think I've been running on, sorry.
What she's been under, because there's various things that could come out. But...
Well, we can't repeat half of them.
What happens in the operating theatre stays in there.
It's the rule.
I've heard that
Your
one,
back
yeah.
rest up a bit.
No, it's just
Yeah,
the rule.
please.
It's the rule.
There we go. So no climbing out of bed, okay? Until a nurse comes and tells you can. If you need anything at all, you press on that, okay? I'll get you some water sent down and you'll be able to have a cup of tea and that, okay?
All right, thanks.
All right, lovely to meet you. Take care.
Thank you.
Bye-bye.
Take care, bye.
All right.
Yeah, you?
Yeah, good. Can't see any different, but how do you feel? Nothing, no.
Doesn't hurt.
No, not yet.
Just tired.
Tired, yeah.
Mm. I just
But
came
you have
round
to
and
have
they
one
were.
of these. You need one of these.
What, when I go home? Yeah, a cup of tea.
Yeah.
Tea.
After 40 minutes on the ward, Thomas's anaesthetic has worn off and he's ready to be discharged.
Right, Tom, let's get rid of this cannula, my man.
Okay.
Just going to move this out of the way. Right, just hand over here. So the worst bit's just the sticky bit, yeah?
Okay.
Because unfortunately it plucks all the hairs off the back of your hand. Ow! Ah, come on, you've got girls in the room. Arm floppy? Lovely. Wasn't that bad, was it?
I don't remember much.
Squeeze,
No.
isn't it?
Yeah, exactly. It's gone.
You look pregnant.
Les Bunn has had investigative surgery to see if his bladder cancer has returned.
Did he say whether he found anything?
No, I didn't say.
His surgeon, Mr. Amanu, has the news.
When we went toward the middle, there was a scar, a dense scar. So we had to slit the scar with the pinhead knife. And then we went up to your bladder, and then we have seen the bladder. Good news, no recurrence in the bladder.
Lovely.
Yeah. So, but because of this dense stricture, the scarring, I need to put a catheter to allow the thing to heal. So in 2 weeks' time, we'll bring you back and then remove the catheter. And then after 3 months, we need to have a look in the bladder again, for the cancer surveillance. Mm-hmm. Okay. Do you want to ask anything more?
No, it's
okay. Are you okay?
as long as thanks very much.
Okay,
indeed.
thank you. Are you happy to go home
Yeah.
today? Okay, good.
Yeah, lovely. Thanks very much.
Thank you
indeed.
very much. Have a nice day. Okay,
Yeah.
bye-bye.
Much obliged. Thanks very much indeed.
Thank you, thank you.
Hello.
Hiya.
Hello. How are you?
Yeah.
Fine, thank you.
Feel all right?
Yeah, fine.
Not too sore?
No, not at the moment. Just blocked up.
You
But
just said it was a little bit sore, though, didn't you?
Yeah, it will be a little bit.
So that area that's been bleeding, there was a little bit of raised tissue, just sort of inflammatory tissue, and I've cauterized that.
Yeah.
So it should all scar down and stop bleeding now.
Yeah.
You may get a little bit of blood streaked mucus coming out for a day or two, so don't worry too much about that.
Okay.
Okay, it's just this little area.
Yeah.
It's a very rich area of blood supply to that part of the nose, and it's very prone to bleeding.
Yeah.
So hopefully this will be an end to it.
Brilliant. Okay.
All right.
Yeah, thanks very much.
So when they're ready and they're happy, we'll just get you home.
Yeah, good.
Okay.
Yeah, take it easy.
Yeah.
You know, I mean,
Yeah.
no cooking, cleaning, anything like that. It's all down to
No problem.
No problem.
Dean's taken me home and he shall wait on me hand and foot this evening, hopefully. Thanks ever so much.
Good. All right,
Thank
we'll sort
you.
that clinic appointment out for you.
Yeah, cheers. But I'm not allowed any alcohol, so the gin and tonic will be out with a question. So, chin chin. In the absence of gin.
Leslie has not had another nosebleed since her operation. She's now feeling well enough to train for a 10k run. Thomas only had one day off school after his teeth were removed. He's now waiting to have braces fitted by his dentist.
Bye, thank you.
And since the operation on his urethra, Les has been free of pain. His cancer has not returned, and he now only needs yearly checkups.